Wassen El Shahid. I am a clinical social worker with 2 decades of experience working with patients who have had problems with suicidal ideations. For the next few minutes, we're going to talk about suicide awareness and suicide prevention. Please, take an imaginary trip with me. Your phone rings. You answer your phone. You discover you're being contacted by a close friend who informs you that their spouse has just committed suicide. What would you say? What would you do? What would you think? Or would you just be speechless and feel totally overwhelmed by the whole subject? For the next few minutes, I will be discussing 7 signs of suicidal ideations. Actually, the classic textbook description of a person who is contemplating suicide is that they always have told someone that they plan to take their lives. It is important that we are aware of the things that we can do to prevent the loss of a valuable life to suicide. There are no absolutes in this business of saving lives or preventing suicides, but we're going to discuss 7 of the most prevalent ones. Number 1, the individual will show an increased disregard for life. If you observe a person who is beginning to behave in a reckless manner, as if they don't care if they live or die, that might be an indication that this individual is having some suicidal ideations. Number 2, increased binges. If the individual is a substance abuser and you've noticed a dramatic increase in abuse, use, and being totally inebriated, that might be another indication that they are having suicidal ideations. Number 3, withdrawing from the public, withdrawing from pleasurable pursuits. It's a phenomenon that we call anhedonia, meaning those things that don't bring you joy and pleasure in life. The things that did bring the person pleasure no longer does it. And they seem to be to themselves, very quiet, very withdrawn, sleeping for long periods of time, and exhibiting signs of fatigue and loss of interest. Number 4, making sure business affairs are in order. Frequently, an individual who's having suicidal ideations will want to make sure that their will is in place, that their business affairs are in order, debts have been paid. They may even bid farewell to their loved ones. And a suicidal note is really a very strong indicator that the person is having suicidal ideations. These are important steps to note because you owe it to yourself to know how you can help yourself or someone you care about prevent suicide. Warning sign number 5, eliminating prized possessions. If an individual is giving away things as if they have no use for them in the future, that too may be an indication that this individual is having suicidal ideations, and behaviorally they are sending the message that the things that they once prized, that they once held near and dear, no longer matter. Why? Because they're not going to be around to enjoy these things. Number 6, conversing about subjects related to death. These individuals will focus and seem fixated on topics and subjects that are morbid and that are leading into contemplation and discussion of suicide. Number 7, bidding farewell to others. As I mentioned earlier, bidding farewell to others can be done any number of ways. One way that's very commonplace is leaving a suicidal note. That last message, that last communication to the world. And now in the digital age, it may be a post in their Facebook, it may be on YouTube, it may be a text message. The shape and form of the communication may vary, but the message is the same. Life is no longer worth living, and I'm planning to end it at this point. A significant number of people who have suicidal ideations are those persons experiencing terminal illnesses. Individuals who are terminally ill frequently feel so disenchanted with life itself, so angry, so upset about the fact that they are terminally ill and how could this happen to them? Why did this happen to them? And they can't go on living knowing that in the next 3 months or 6 months or 3 weeks they're expected to expire. They will frequently contemplate and idealize suicide as a way to end their physical and emotional pain and decide that life, the quality of life, is no longer worth living. You and I know that's not true, but to that person, that is their reality. And so there's nothing that you can say to make them feel like they are not correct in feeling the way they feel. So, in order to be helpful to them, don't try to explain to them how fortunate they are, that they're not worse off, how you think suicide was a stupid idea in the first place. None of these things will help a person feel more supported when they express to you that they're feeling like they should end their lives, take their lives, do themselves some harm. Another category of people who have suicidal ideations are veterans. Those individuals, especially who have been involved in combat, who have seen a great deal of death and dying, who have been in service and combat in hostile areas for long periods of time. There are 5 reasons of the several that we will talk about today. Number 1, exposure to extreme stress is very common among combat veterans. Number 2, service-related injuries. Imagine a 22-year-old or a 24-year-old person who loses a limb or who winds up being very disfigured because of an explosion. This has been especially true and quite problematic for those young men and women who are fighting wars in the Middle East, where there is the high probability that you will run into an improvised explosive device. The third category of veterans is those who have been deployed to hostile countries. Many of the countries that these young men and women are in are hostile to our presence, despite the fact that their intentions are well-meaning and they're giving of themselves to support their countries. Frequently, the countries they're in are hostile environments to them, and this too could lead an individual to feel that he should end his or her life prematurely due to this pain. Number 4, physical and sexual assault while in military service. This is especially true of young men who are perceived by their peers as being gay and who may be gang raped, and by young women service persons who are frequently preyed upon by their comrades because they happen to be the objects of someone's sexual desires or fantasies. Many of our veterans have difficulty recovering from these type of physical and sexual assaults. Some never do, and some do choose the suicidal option. The 5th one is the length of deployment. There is definitely a correlation between the length of deployment and the level of stress that an individual feels and the severity of their contemplating and idealizing suicide. You and I know suicide is not the answer, but to the person who's in the situation, who's experiencing these emotional pains, it is their reality. There is a misconception that I'll explore at this point, and that misconception is that an individual will become more suicidal if in fact you were to ask them if they're having suicidal ideations, if they're contemplating committing suicide. Nothing could be further from the truth. However, it's a myth. Actually, the opposite is true. If a person is contemplating suicide or having suicidal ideations, by asking them if they are feeling suicide or having suicidal ideations, you give them an opportunity to discuss their feelings, to discuss their plans as related to suiciding. So, in most cases, it's a helpful gesture of support to ask an individual if they're having suicidal ideations, if they're contemplating suicide, if they're contemplating self-harm, because they need to know that you're there to be supportive to them, to help them in their recovery, and to enhance their resilience from the place they're in when they feel like ending their lives. If you know of anyone who you are concerned about because they're experiencing what you feel are suicidal ideations, you should immediately call 911 or help them get to a facility where they can receive assistance with the problems that they're having, especially if they want to harm themselves. Should you call 911? Should you be very alarmed if someone says they would like to kill themselves? There is a criteria for determining whether a person's suicidal ideations are imminent or whether they are cries for help. The two ways to differentiate the levels of risk that the person is for committing suicide is we divide it into two different categories: active suicidal ideations and passive suicidal ideations. The risky one, however, is the active suicidal ideations. Active suicidal ideations we assess by simply asking the person, are you contemplating suicide? Would you like to harm yourself? If the person says yes, and frequently they will say yes, the next question is, if you were going to kill yourself, if you were going to end your life, how would you do it? If that person is able to elaborate a detailed plan on how they would take their lives and have the ability and the resources to carry out this plan, then that person is an active suicide risk and a very high risk for attempting to commit suicide. A person experiencing passive suicidal ideations will verbalize wishes to die, will tell you that life isn't worth living and they would like to end it all. But if you were to ask them for a specific plan, they would be unable to give you a plan. They may tell you something like, I haven't given it that much thought, I don't know how I would commit suicide. I don't know how I would kill myself. You can then rest assured that that person is making a suicidal gesture, a cry for help, a plea for understanding and compassion from the persons who are in his environment, and is really someone who doesn't actually want to die and would probably abort a suicide attempt if they were to actually make it. So it is not unusual for even strong people to think about or contemplate committing suicide, especially given situational stressors like the loss of a loved one, someone they feel very close to, very near and dear to, or if it's someone who has several severe problems that they encounter at one time. They're being divorced, they lose their mother, they lose their job. These people are usually able to be resilient enough to bounce back from these defeating situations and to realize, based on their better judgment, that help is better to be sought than ending their lives. Suicide, remember, is a permanent solution to temporary problems. Thank you for your time and your attention. If you like this webinar, please subscribe using the link below.